use sandpaper or something to polish it, right? Make sense? So first you roughly put there, right? So the medullary cavity will be formed like roughly. Then osteoclast will do what? Like work like sandpaper. Polish, right? Will make it nice. To do that, it has to destroy the matrix. Make sense? Excess matrix. Okay. Then what will happen? Who will penetrate? Blood vessel will branch, right? And at the ends, you will get secondary ossification centers. Okay, so 2 more centers will appear later, and from primary, the bone formation will continue, right? And from secondary, bone formation will start, and the space in between is cartilage, right? Still cartilage, and that is called what? Growth plate, right? Or epiphyseal plate. So it shrinks gradually, right? Gets smaller. And by looking at the thickness of this growth plate, we can determine the age of that person, growing person. Okay? And this is a very good clue to find the age of, like, unidentified person. In forensic medicine, forensic, they found a dead body, right? They want to determine the age. So they will look at the growth plate. Make sense? How thick, and it changes in very timely manner. Okay? Very specific age manner or time manner. Okay? So you can very specifically tell the person of that growing person's age. Yes.
So we're talking about mature bone. What at age what? 21? What is a mature bone?
Even before, like at like around 15 or 16.
15.
That's growth plate.
So that's a one-time cycle, or it doesn't repeat itself?
No, it will not.
Just one
But,
time.
but you have different bones, right? And different bones grow in different time periods. So that is helpful, okay? Like if you see humerus and femur, the time is slightly different, okay? So you can study the bones and tell that it is more specific. Okay, so that's the endochondral ossification. So those are 2 types of ossification or bone formation. Okay. Here you see the primary ossification center here. This is hyaline cartilage. The body collar is formed and primary ossification center. Medullary cavity is formed. Blood vessel enters and divides. Okay. Secondary ossification centers, bone formation starts, and this is the growth plate. Okay. In between. And these cartilages will never be converted to both articular cartilage or joint cartilage and epiphyseal plate cartilage. Okay, good. Now, blood supply of a long bone. You know that bones are vascular. That means bones have blood vessels. 3 sets of blood vessels give blood to a long bone. What are those 3 sets of blood vessels? Through the middle of the shaft, the blood vessels penetrate. Those are called nutrient blood vessels. Nutrient. So, let me draw here. So this is a long bone, and through the middle of the shaft, nutrient vessels, okay, artery and vein. Then, through the area where you have the epiphyseal plate, the blood vessels penetrate or pass. Those are called metaphyseal. Metaphyseal vessels. Okay. You see here, metaphyseal vessels. Okay, another set. And number 3, the covering of the bone is called periosteum. You remember, periosteum. And in the periosteum, you have another set of blood vessels. Not really in the bone, but in the covering of the bone here. So that is called periosteal blood vessels. Periosteal blood vessels. Okay? In the covering of the bone, just outside of the bone. And from periosteal, the outer part of the bone gets nutrition and oxygen. Okay, so those are three sets of blood vessels supply blood to a long bone. Okay, make sense? So if I ask you the shaft part, inside the shaft gets blood from which blood vessels? Nutrient. Make sense? The end parts, metaphyseal. Is it clear? And the outer part of the shaft, periosteum. Is it clear? Okay. So those are three sets of blood vessels supply blood to different parts of the long bone. Okay? Bone remodeling. It's very important. I said that bone formation and destruction both happen together. I'm repeating again. Bone formation and what? Destruction both happen together throughout the life. Is it clear? So always both are happening inside your body, right? The skeleton. Now you tell me, which one is more in early part of your life? Formation is more, right? That's why bones grow. Destruction is less, right? Bone grow, your body grows. In late part of life, which one is more? Destruction becomes more. Okay? Replacement or formation is what? Less. That's why bones get what? Weak, right? Fragile. Right? And shrinks. So, that is bone remodeling. Formation and destruction. And the turnout is different in different parts of your turnover is different in different parts of your life. Last thing, the hormones that work on the bones. I mentioned at the very beginning that two types of hormones work on the bones. One type of hormones help in what? Help in? How many of you remember? Growth, I mentioned. Help in bone growth. Okay? There are a few hormones that help in the growth of the bone. Make sense? So work on the bones. Another type of hormones help in calcium regulation. Regulation of calcium in your blood, which is very important. Remember, calcium is very important mineral. Okay? So, which hormones help to grow the bones? Growth hormone. Have you heard the name? I believe all of you, right? Growth hormone, very commonly used. Many farms, they use growth hormone to grow the cow or chicken, right? Sometimes they use too much, which is like not good. There's a lot of debate, right? And this could be a torture on the animals. Okay, so growth hormone helps in the growth of the bones. That's the main one. Its name is telling you. Other two types of hormones, thyroid hormone and sex hormones, they also help in the growth of the bones. Thyroid hormone actually doesn't work directly on the bone. It modulates the activity of growth hormone. Okay? So, acting on the growth hormone and changes its action. That is thyroid. Sex hormones. Testosterone, estrogen in female, testosterone in male. You all know you know, when the kids get at puberty, right? Body suddenly grows, right? If you just saw that kid like 2 years ago, now if you see after 2 years break, you see that kids, right, grow a lot. Why? Because at puberty the sex hormone, right, is produced in the body. Secretion occurs, and that works on the bones to grow the bone. Make sense? So you already know that, right? So those are the hormones help to grow the bones. Now there are few hormones that work to regulate the calcium in the blood. First thing, you all know by now that the matrix of bone contains what? Calcium phosphate. Remember? Inorganic minerals. So huge amount of calcium is present in the matrix of the bone, right? Heavily filled with calcium, right? In the bone, which work as a stored calcium in your body. Stored what? Calcium in the body, your bones, the matrix of the bones. Now, if in your blood the calcium concentration drops, declines, the bones will release what? Calcium. Will give the calcium to the blood. Makes sense? Because I said that matrix of the bone contains huge amount of calcium. You know that. So that works as a stored form of calcium. So if in your blood the calcium concentration goes down, bones will release the calcium into the blood. Make sense? Calcium will go up. Is it clear? Okay. Now you tell me, from your common sense, there is one type of bone cells that are giant and love to destroy the matrix. What is that?
Osteoclasts.
Osteoclasts. Remember that? Osteoclasts. They love to what? Destroy the matrix, right? So what happens if the concentration in your blood, calcium concentration goes down, osteoclasts become what? Active. Okay? And will destroy the matrix, and calcium will come out from the matrix, will enter into the blood, blood concentration of calcium will go up. Is it clear? Okay. Now somebody has to tell the osteoclast that you become active, right? That is the hormone. Okay? So hormone will tell the osteoclast that, you know, blood calcium is low, so now you break the matrix, okay? So osteoclasts are activated by the hormones. So which hormones? Parathyroid hormone, PTH, secreted from parathyroid gland. Okay? So if the calcium, now let me write it down. If the calcium concentration in your blood goes down, that will stimulate the parathyroid gland. Parathyroids to release parathyroid hormone, PTH. That is the hormone. Parathyroid hormone from parathyroid gland. Very simple. The parathyroid hormone will increase osteoclast activity. Activate the osteoclasts. Okay? So that will break the matrix of the bone, which stores huge amount of calcium. So calcium will be released. And that will increase the calcium in the blood. Okay? So fix the problem. Problem is fixed. Make sense? Does it make sense? Yes? No?
Yep.
Okay, good. So if the calcium concentration in your blood goes down, parathyroid hormones will secrete parathyroid glands will secrete parathyroid hormone. Parathyroid hormone will work on what? Which type of bone cells? Osteoclasts. And osteoclasts will do what? Break the matrix. And matrix deposits huge amount of what? Calcium, right? So calcium will come out from the matrix, will enter into the blood calcium will go up. That's the main action, how the hormone regulates the blood calcium. Is it clear? Okay. Now, if the blood concentration of calcium goes up, high, the hormone should do what? Tell the osteoclast to do what? Keep quiet, right? Sleep. You sleep, don't do anything. Okay? So exactly same thing happens. If the concentration of calcium in your blood goes up, usually it goes down, but sometimes that can happen, goes up, then what will happen? The thyroid hormone, another type of hormone, thyroid hormone, calcitonin, this one, will tell the osteoclast not to become active. Keep quiet, stay quiet. So osteoclast will not break the matrix at all, and blood calcium will gradually go down. So just opposite of parathyroid. So these two hormones now you see work in opposite way. Okay? This one activates the osteoclast, this one inhibits the osteoclast. Okay? So parathyroid activates the osteoclast, thyroid hormone calcitonin decreases the osteoclastic activity, inhibits the osteoclasts. No breakup matrix, no release of calcium. Okay? So blood calcium will go down. So just in opposite. If you know one, you know another. Does it make sense? If you know how parathyroid hormone works, calcitonin is opposite. So that's the main way how the hormones regulate the calcium. Parathyroid hormone, this one, also works on two other organs, kidneys and intestine. So basically it works on the osteoclasts of bones, but it also works on kidneys and intestine. Now you tell me, think very simple. If in your blood the calcium is low, okay, parathyroid hormone should tell the kidney to excrete calcium or preserve calcium. In your blood the calcium is low. Parathyroid hormone should tell the kidney to excrete the calcium from the body or retain it. Excrete. Already in your blood, in your body, it is low. Should the parathyroid tell to excrete or keep it? Retain, because your body has already low calcium, right? If kidneys excrete more through the urine, then what will happen? Yeah, excrete means through the urine. Excretion of kidneys produce urine, right? Make sense? So, did you get it? In your blood, already low, right? So, parathyroid hormone will tell the kidneys to retain, not let the calcium get out through the urine. That is very simple, right? Make sense? So, that is the action on the kidneys, okay? And on intestine, parathyroid hormone activates vitamin D. Vitamin D works on the intestine and absorbs the calcium from the food you eat. I am repeating again. Vitamin D works on the intestine and absorbs the calcium from the food you eat. Okay? Now, parathyroid hormone activates the vitamin D more. So, more vitamin D will work on the intestine and will absorb the calcium, absorption of calcium from the food you eat. That means from the food, more calcium will be taken into the blood, absorbed into the blood. So blood calcium will go up. Okay? So parathyroid hormone works on those three organs. On bones, increases the osteoclastic activity, that's the main action. Break the matrix, release of calcium, blood calcium will go out. On kidneys, will tell not to let the calcium get out from the body through urine. So we'll preserve. So that way also calcium will go out. We'll activate vitamin D, that helps in the absorption of calcium from the food in the intestine. That is. Okay. So all three together will increase the calcium in the blood. Okay. So now let's summarize this. Last thing, okay? Parathyroid hormone or PTH. Parathyroid hormone increases or decreases calcium? Increases calcium, right? Increases calcium in the blood. It works on how many organs? Bones? Help me.
Kidneys.
Kidneys. Very good. And intestine. Is it clear? On bones, parathyroid hormone stimulates or activates which type of cells? Osteoclast. That will break the matrix, right? On kidneys, it will retain the calcium, will not let the calcium get out through the urine. Make sense? On intestine, does it work directly or indirectly? Through something?
Absorption.
Absorption, but who does that? Vitamin D, right? So, parathyroid hormone will activate vitamin D, right? And vitamin D will absorb the calcium. So, indirectly, right? Anyway, good. So, we'll work on these three organs. Works on bones, kidneys, and intestine. Okay? Okay. And it comes from parathyroid gland. Parathyroid, that's why it is called parathyroid hormone glands. How many parathyroid glands you have? Anybody? 4 to 8, right? It can vary the number, 4 to 8. Very good. So that is parathyroid hormone. Calcitonin. Calcitonin does opposite, right? Action is opposite. That means lowers the blood calcium. Lowers the blood calcium. So this one, calcitonin, works in opposite way. Okay, and calcitonin comes from thyroid gland, not parathyroid. Thyroid gland. Okay, so calcitonin inhibits the osteoclasts, osteoclastic activity. Okay, just opposite. Okay, so that's all about the hormones. Why calcium is important? I said calcium is a very important mineral because calcium performs a number of very important functions are listed here. Transmission of nerve signal. What kind of transmission? Nerve signal? Electrical, right? Remember? Electrical signal transmission, that is helped by calcium. Muscle contraction, very important. If the calcium in your blood goes down, at one point the muscles will be paralyzed. Your respiratory muscles will stop working. Make sense? So the person may die in hypocalcemia. If the calcium drops, okay, the paralysis of the muscles will occur, and respiratory muscles paralysis will cause what? Death, right? If you cannot breathe, your respiration stops, the muscles are not working, right? It may cause death, right? So you see, the calcium in your blood is very important. Okay? Calcium helps in the secretion from the glands and nerve cells. You remember when I talk about the cells, the vesicles are formed from Golgi apparatus. Remember? Vesicles contain the chemicals, they go to the cell membrane and do what? Rupture. Exocytosis. Okay, remember that? Exocytosis to release the chemicals. That rupture is helped by calcium to secrete the chemicals to the outside of the cells. Make sense? So that is helped by calcium. So calcium has a number of important functions in the body, right? And without calcium, the person, if the calcium concentration goes down, that is called hypocalcemia. Hypo means lower, right? Hypocalcemia is a condition where the muscle paralysis, nerve signal transmission will be slowed down, and a lot of problems will be occur. Here they have shown how if the calcium concentration goes down, how the parathyroid hormone glands, these are parathyroid glands, will work. Okay, that I have explained. These are osteoclasts. We'll break the matrix. Now, what is normal concentration of calcium? You need to know that. Okay, write it down or mark it. 9 to 11 milligram per 100 milliliter of blood. Very important mineral. That is the concentration, 9 to 11 milligram per 100 milliliter of blood. If it goes below 9, that is hypocalcemia. If it goes above 11, hypercalcemia. Okay. Fracture of the bones. Let's finish it quickly instead of waiting. So fracture is a common term. We know that. How we name the fracture? We name the fracture by location, the appearance and nature of breath. This is a fracture. You see multiple fracture in one location. This happens in older people. The bones become fragile. So when fracture occurs, we see multiple fracture in same location in older people, and that is called comminuted fracture. Comminuted fracture. If the fracture occurs due to vertical pressure like this, if you jump from height, okay, what happens? Your vertebral column, right, takes the pressure. So that will crash the vertebrae, like this kind of pressure, vertical. That is called compression type fracture, you see here. So that happens due to vertical pressure. Spiral fracture, a single fracture but oblique, not transverse like this. This is an oblique fracture. Okay? Usually occurs due to twisting force. Like if I hold the bone like this and twist like this, that will cause that oblique spiral fracture. Okay? Epiphyseal fracture. Now, you remember I said that epiphyseal plate, the thin plate of cartilage, right, will remain throughout the life, right, as cartilage, and that is a weak point, right, in your bone. So that is the location you see here. Fracture occurs, and that is called epiphyseal fracture. Makes sense, right? So epiphyseal fracture here. Your epiphyseal plate is here. Depressed fracture. If you see that after fracture, the bone goes inwards. Goes what? Inwards. That is depressed fracture. Like if something falls on your skull, head, that broken piece will go inwards towards the brain. That happens in earthquake or road accident, that can happen. Okay? Green stick. This is interesting. Partial fracture, not complete fracture, the partial fracture, like this. This is the bone, okay? This is the bone. The fracture is partial and branching. From the fracture, you see tiny branches. That usually happens in young kids because their bone is more flexible, so it will not break completely, okay? Partial fracture, and from the main fracture, you see multiple branches. So that is called green stick type fracture, okay? Usually happens in young kids or children, okay? After the fracture, what happens? How the healing of the fracture occurs. This is fracture, you see here, and bones have blood vessels, you already know. So a lot of bleeding will occur there. Accumulation of blood is called hematoma. Accumulation of blood is called hematoma. So that happens first. Swelling, right? Bleeding. Then what happens gradually? The space between the bones is filled by fibrocartilaginous callus. That means fibrocartilage. Soft bone will be formed. Okay. Then that fibrocartilaginous callus will be converted to hard bony callus. So matrix will be deposited and it will become hard bone. Now you see the last thing, what is important, after the bony callus is formed, the surface is still rough and elevated, you see here. So you will see after the bones join together, if you touch that area, you will see still rough. It's not very smooth, right? Now you remember I said which type of cells work like sandpaper? Osteoclast, right? So we'll first roughly that space will be filled. Okay? Then osteoclast will work, right? Slowly to make it smooth. So that is the remodeling, okay, by the osteoclast. So those are the steps of healing. Hematoma is the accumulation of blood. Fibrocartilaginous callus will fill the gap. Then it will become bony callus. And then remodeling is osteoclast will polish the surface. Will make it smooth. Okay? So that is healing. Rickets is bowing of the leg bones. Here we don't see many rickets patients, but if you see in developing countries, you will see many ricket patients. The kids' leg bones get what? Bowed. Okay? Bent. Why that happens? Because we know that calcium is very important mineral, right? That forms the matrix, gives the hardness of the bone. So if that kid doesn't get enough calcium in food, right? Then what will happen? The bones will get weak, right? And your body weight is not transmitted by upper limb bones, transmitted through the leg bones, right? To the ground. So always pressure is going through the leg bones, okay? So leg bones gradually, because they are weak, so will bend. Make sense? So that is rickets. Due to calcium, lacking of calcium, or vitamin D, because you know vitamin D helps in calcium absorption in the intestine from the food you eat. I have explained that, right? So vitamin D or calcium lacking will cause that. Two more clinical conditions. One is called rheumatoid arthritis. Rheumatoid arthritis. That is the inflammation of soft tissue in your joint. Soft tissue inflammation. Okay? That is called rheumatoid arthritis. Not bones, the soft tissue like capsule, right? You have capsule in the joint, you have ligaments, right? Tendons, those are soft tissues. Bones are hard. So that is rheumatoid arthritis. And you have probably seen rheumatoid arthritis, right? Patient. It's a swelling, redness, right, and severe pain. Another clinical condition that is called osteoporosis. Osteoporosis. You have heard this one too. In this case, the bone itself is affected, not soft tissue in the joint, but bone itself. What happens? Many tiny holes are formed in the bone. You see the spongy bone of a normal person. This is a trabeculae. And this is osteoporotic patient. So you can see that many holes make the bone tissue really weak, okay, and fragile. So that's the osteoporosis. Normal bone above, spongy bone, and below osteoporotic. Okay, so in osteoporosis, the bone itself is affected. Okay, so